Okay, you're on.
Okay. Hi, I'm Vicki, and I work for the hospital. And usually the first comment people say to me is, "You don't need that surgery." Well, and they do, and they have. And it was a tough haul to work through all the different processes, and I understand it takes time and, contracts and so on, but it was so well worth it. So well worth it. And I'm thrilled for all of CHW that we have this benefit. It is a wonderful benefit. What I found out after surgery is I probably had more issues than I even realized. My blood sugar went up to 165. I knew I was pre-diabetic, but that's not pre-diabetic at 165. My O2 sat went down to 85%. Normal is, for a normal person's 98 to 100. That's very low. That will put you in the hospital per interqual criteria. I'm a case manager, by the way. So I probably had undiagnosed sleep apnea per Dr. Rutledge. And then I also have hypertension and high cholesterol. I feel like this basically has saved my life and added multiple years to my life by having the surgery. Now, when I preoperatively, excuse me, a little dry here, I weighed 200 pounds when I came in. With the comorbidities, my BMI was 35, which is the criteria to have the surgery. With the complications, had I not had the surgery, I probably would have a shortened life of, what, 30?
The numbers are that if you're above a BMI of 35 with associated medical illnesses, you give up between 10 to 15 years of life.
Isn't that awful? So I am so thrilled to have been qualified for the surgery with the comorbidities and save that much time, because I have a 16-year-old. I was a late bloomer. And I want to be around for him and my husband. So
And your surgery went smoothly?
very smoothly. I had some post-op pain. The pain pump quit working during the middle of the night. But we're having an in-service tomorrow, by the way,
Very good.
to work on what we need to do if the pain pump does quit working.
Is it okay to say you work on our floor, the fourth floor?
Absolutely, I do. I work on the 4th floor where most of the MGBs are put. That's what we try to. Sometimes beds get really tight, and you may be on a different floor if that happens, but we try to accommodate and have the MGBs, because we do have the nurses who are very familiar with the surgery, and they're excellent. They really
They
are.
are excellent. Oh my
All right, let's say,
goodness.
let's hear it for the nurses on board.
And I have 3 patches on. And I've had a hysterectomy, so that's kind of weird.
Yeah, and again, it's important to point out that one of the exciting things about the surgery is the expected drop in estrogen levels over time, and it often improves your risks. We expect long-term chances of getting breast cancer and endometrial cancer, so those are good things. Lowering your estrogen is good. Lowering it suddenly, though, can make you a little grumpy. So, or cheerful. Right. Now, since this is going to be on the internet and everything, if you agree, would it be all right for other CHW employees to contact you
Oh,
up on the
please
4th
do.
floor and tell them about your experience and things like that?
Please do. I mean, anyone that needs information about the hospital, the surgery, my experiences, I'm happy to share those.
Okay.
Absolutely.
You don't mind being a contact person?
Not at all. Not at all. So,
How do you feel about having your staples out?
oh, perfect. Fine. No problem.
All right, let's see now. I think you handed me this.
First, gotta make sure we don't expose too much here.
All right.
So, and mine look great. There aren't any bruises.
Whoa, beautiful. Congratulations. That looks good.
Did he do a tummy tuck on you too, or what?
No, he didn't, but I guess I'm solid. I'm very solid.
I think the scariest thing that we found was the low oxygen after surgery. And we think probably most of our patients who are overweight have undiagnosed lung disease, and so it's exciting to think that's going to get better.
I've lost 7 pounds.
Congratulations. Applause.
I'm excited.
Thank you very much. And again, thank your husband for not kind of giving me a punch in the nose.
Yeah.